diagnosed with a mental illness in conjunction with substance abuse are often isolated and refrain from social and leisure participation. Socialization is needed for health. Thus, it is important to participate in recreational and community activities, as well as various levels of peer and friend intimacy and family interaction. According to the American Occupational Therapy Association, occupation and health are positively correlated, and engagement in occupation is central to health and well-being. Mr. H is a 21-year-old male brought to the emergency room by the police after stabbing his cousin. He got into a physical fight with his cousin because he said, "The voices told me to do it." The patient continues to say that for the past year, he feels that people are not really who they say they are. He hears two voices constantly telling him to do bad things. He admitted to abusing alcohol due to breaking up with his girlfriend and dropping out of school. This has been going on for 8 months. He also mentioned that when he drinks, the voices become loud. At the hospital given to Mr. H, it was noted that Mr. H presented to be dirty and disheveled with poor hygiene. He denies any suicidal or homicidal ideations. He was brought to the psychiatric unit of the hospital for further eval and was referred to occupational therapy by the physician. Mr. H was diagnosed with schizophrenia paranoid type, which is DSM classification 295.30, with substance abuse. The OT checks the medical records and chart, which indicated 2 previous admissions to a psychiatric hospital within the past year and a half. The client interview. The occupational therapist would proceed with a client interview to obtain Mr. H's history. So we're going to pretend that Chuck E. Cheese is Mr. H for the client interview. So the occupational therapist would invite Mr. H to the office and shake his hand, say, "Hello, Mr. H, how are you?" And I would introduce myself. My name is Anita Kimai Ramasar. I'm the occupational therapist in the psych unit, and how are you today? Then I would obtain Mr. H's name, birthday, whatever information, just to see if he's oriented. I would ask him the time, the date, the place that he's in, why he's here, and rule out if he's oriented times 3 or not. Then I would obtain Mr. H's medical history. Mr. H's medical history is that he's diagnosed with paranoid schizophrenia and alcohol abuse, which was mentioned earlier. No other medical alerts or problems are apparent right now. A family history of schizophrenia is with his mother, and he is currently prescribed Haldol 5 milligrams a day, and Mr. H is indeed oriented times 3. His personal social history, he's currently single, he isolates himself in his bedroom, and he doesn't engage in recreational social activities with friends or family anymore. He lives at home with his mom and his dad, who are very supportive. Currently, his occupation is being at home, and he dropped out of school. His chief complaint is insomnia and hearing voices talk to him. With all of this, the occupational therapist will develop a problem list and a treatment plan and assess Mr. H with the appropriate assessment tools. The evaluation tools chosen for Mr. H will be the occupational therapy priority checklist. This checklist identifies the needs of the client and will assist with making a professional judgment if the client needs to receive occupational therapy services. So this occupational therapy priority list checklist can be obtained by the MOHO website at www.moho.uic.edu. And what it really is that it looks at the 4 sub-skills of MOHO, which are volition, habituation, performance, and environment. And it looks at the client's interests, self-care, productivity, leisure, interpersonal skills, cognitive ability, physical environment, and social support. So the therapist would just briefly ask Mr. H some questions and jot down his information on this checklist to help make a professional judgment if he needs occupational therapy or not. This is just to help the therapist in the decision-making process. Then the occupational therapist would probably select a drug alcohol timeline, follow back calendar. This is used to summarize the current month as well as the previous 6 months of the client's substance use. So this assessment tool will help Mr. H see, as well as a therapist, of his drug and alcohol use, how many times of day or the month that he uses the alcohol or drug or both, and what type. So this is a useful assessment tool as well. And then the occupational therapist would proceed with an interest checklist, maybe not on the same day, but on another day or for a therapy treatment session, to develop leisure interest and exploration for Mr. H. Also, the occupational therapist, with all the assessments and everything, will conclude that Mr. H has issues with time management and coping strategies, leisure and social participation issues, and vocational exploration and training is one of his wants and needs for occupational therapy as his goal. Occupational therapy aims to have the client return to life filled with satisfaction and purpose through the engagement in occupation. And occupational therapy will focus on developing the client's occupational profile, which consists of their strengths and limitations, their support system, which is his parents, his goals and priorities. Occupational therapy will help identify the stages of recovery and overcome real-life issues. There are 4 stages of recovery, which consist of engagement, which is no regular contact with the dual diagnosis clinician, which indicates no motivation in self to change. The second is persuasion, which is regular contact with clinician but no change in substance abuse behavior. The third is active treatment, which is reduction in substance use and positive motivation. And the fourth is relapse prevention. No problem with substance abuse in the past 6 months, and that's where we want all of our clients with substance abuse to get at. Mr. H, I think, will benefit from dual recovery treatment therapy, which aims to promote relapse prevention because he has 2 prior admissions to the hospital for the same issues. He also has decreased social skills and needs training with leisure and social participation, and he's currently isolating himself, and he needs to be in the process of recovery. So the dual recovery treatment approach would be most appropriate. The occupational therapist works in collaboration with the entire team at the psychiatric ward. There's a team meeting once a week to discuss individual cases. The team consists of social workers, doctors, the psychologists, the nurse, the staff, occupational therapists, physical therapists, and other healthcare professionals. Occupational therapy treatment will focus on adjunct therapy, functional activities, and purposeful activities for Mr. H, which some are, like maybe an adjunct activity would be his ADLs such as grooming, functional activities such as leisure exploration or identification of leisure interests or vocational interests. And purposeful activity will be finding employment or checking the internet for returning back to school or looking for available jobs. The dual recovery therapy will involve individual therapy one-on-one with Mr. H and the occupational therapist, which will focus on conversation on the client's current life, relationships with friends and family, social participation, leisure interests, time management, coping skills, and reflection of everything that's going on in his life right now. Group therapy. Mr. H will also be in group therapy for cooperation and to gain insight and awareness of his disabilities and illnesses, and increase interpersonal relationships, addressing feelings of isolation, depression, and/or anxiety, which will facilitate change in the client's perspective and attitude about their quality of life. With this said, the model of human occupation will be used to guide treatment sessions as it defines occupation as being essential to self-organization. It serves as an instrument that occupational therapists can use to assist clients in experiencing greater competency and satisfaction in life. MOHO concepts address the motivation for occupation, the pattern of occupational behavior, the nature of skilled performance, and the influence of the environment on occupation. Pattern. The occupational therapist will also educate parents and family members of precautions and intervention strategies to assist with the client when he or she begins or has an episode. The occupational therapist will also provide additional resources and recommend healthcare professionals appropriate for the client. Coping strategies will also be taught, and calendars and schedules for time management and leisure engagement and social participation will also be given and explained to the parents. A one-on-one treatment session can consist of discussions of coping strategies with the client and to reflect on his behavior and how to resist drinking. And discussions of positive and negative consequences will be discussed as well. A group session will be sharing of thoughts and ideas with other clients that have the similar or same problems as Mr. H. And engagement in filling out job applications or searching the internet for employment opportunities can be done in a group session. Other group sessions can consist of a meal preparation class for sequencing and timing problem-solving skills. This can help the client achieve some satisfaction after having a relapse and negativity because they have independently accomplished tasks. Role-playing is a good treatment session and enacting situations when the client is faced with alcohol situations. Situations of role-playing, a conversation with a friend or family, is also nice to use to promote socialization. In conclusion, Mr. H is currently at the active treatment stage of recovery. The Haldol is controlling paranoid schizophrenic episodes. Mr. H is positively motivated, and a reassessment of the drug-alcohol timeline revealed a reduction in alcohol use. Thank you very much.